Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teachers Module, Homelessness and Health. The objectives of this module is that learners by the end will be able to define homelessness and differentiate between various types of homelessness, describe epidemiology and risk factors associated with homelessness, and discuss the impact that homelessness can have on someone's health. So to begin with, let's define homelessness. Homelessness is a much broader condition and term than what we normally think of. I think that people typically think of someone must be living on the streets without a house in order to be homeless, but that is not true. A homeless individual can be anyone without fixed, regular, and adequate nighttime residence. Someone who has nighttime residence, but it's a public or private place that's not designed for or ordinarily used for regular sleeping accommodation. It can be someone living in a supervised, publicly or privately operated shelter designed for temporary living arrangements. And it can also be someone who actually has housing currently, but who will imminently lose their housing. And this is the definition that's provided to us by the HERF Act in the United States. But essentially, in shorter terms, homelessness is the condition of not having stable, permanent, and adequate housing that is suitable for the individual or family. And homelessness is not, like I said earlier, it's a broad condition. It's not cut and dry, and there's different types. So based on different conditions, the homelessness might be. It could be unsheltered, which is when someone is homeless and living on the streets or in places not intended for human habitation. There's emergency shelter, which is when someone is staying in overnight shelters designated for either some people that are homeless, people affected by violence, or those affected by natural disasters. There's provisionally accommodated homelessness, which is when someone is homeless and without permanent shelter who has access to temporary accommodation. And this is not typically considered homeless by a lot of people, but it definitionally is. It's the condition of homeless that people might think of when they're still sheltered in houses, but they might be couch surfing from friend to friend's house or family to friend's house, but they don't have reliable permanent housing of their own. And then there's also precariously housed, which is when the person, like I said earlier, person has current housing, but it's inadequate, meaning that it's not sufficient for the person's, it's not in good quality, it's not, there's health risk there, something like that, that's making it inadequate. It's unsuitable, meaning that it's, the housing is not large enough for the family or group that's living there, or it's unaffordable, meaning that the family is unable to afford that housing. And so that precariously housed, while they have housing currently, if it's any of those three things, it puts them at risk for future homelessness. Now, in addition to different homelessness conditions that we just described, there's also kind of different homelessness classifications or timeframes. And the first is when someone is chronically homeless, and this means that someone has been homeless for at least 1 year, or someone has had at least four episodes of homelessness within a 3-year period and also has a chronic disabling condition. This is different from intermittently homeless, this is when someone has multiple short, self-limited episodes of homelessness that don't meet the requirements for chronic homelessness. And then there's also in-crisis homeless. And so this is when someone is homeless because of a major crisis, whether it's something related to their job, losing their job, or a family emergency, a natural disaster. This crisis has brought just one episode of homelessness to this individual or family. And after in-crisis homelessness, once the individual or family has stable housing once again, it usually is not repeated because the original homelessness was caused by some type of crisis that was out of the individual's control. Now, with all of these types of homelessness and conditions of homelessness, there are risk factors for an individual experiencing homelessness. Um, and a really strong risk factor for homelessness is poverty. If someone does not have sufficient income or assets, um, they are unable to afford their monthly rent or their mortgage or buying a property for themselves. So poverty definitely has a role in homelessness, as well as males are more common to be homeless than females. Those that do not identify as heterosexual, so the LGBTQ plus population, are at high risk for being homelessness, which we'll talk more about. Being unemployed can be partnered with poverty in the fact that unemployment also can lower someone's income and make them less able to pay their rent or for their living situation. Veterans are also at high risk for being homeless, which we'll talk about in more detail. Someone being single rather than being married or in a relationship with someone puts them at risk for being homeless. Having been in foster care, having been homeless as a child, having been in the juvenile justice system or a runaway child, these out-of-home experiences also increase someone's risk for homelessness. Experiencing abuse as either a child or adult can increase someone's risk for homelessness, as well as someone's chronic illnesses or mental illnesses or substance use, if those are present. Those also increase an individual's risk for homelessness. So there are a lot of different risk factors for homelessness, which is probably why so many people in the United States are experiencing homelessness, as we see that 2.5 to 3 million people in the United States experience homelessness over the course of a year. That data is from 2013. And along that note, out of those millions of people, 1/4 of all Americans who are homeless are children, which is just terrible, as it's something that they can't necessarily control, but that is affecting them. So we'll talk a little bit more about the specific impact on children later that homelessness has. But like I said, I want to talk about two vulnerable populations that are certainly at higher risk for homelessness, one of them being veterans. So 12.3% of all homeless adults in the United States are veterans, which is more than the percentage that veterans make up in the whole population nationwide, making them disproportionately impacted by homelessness. And we see the data shows that there's the highest homelessness risks in male veterans from the post-Vietnam era rather than the World War II and before era. And also all women veterans, despite where their veteran and service eras were, women veterans are at risk for homelessness as well. And then we see common themes or common trends within the veteran population that are additional risk factors for homelessness. So we see high rates of substance use and mental illness within veterans, which along with their veteran status, even further their risk for homelessness. In regards to the LGBTQ population, we see really high rates of homelessness within this that's disproportionate to their percentage within the general population. So 20 to 40% of homeless populations are estimated to be LGBTQ. And LGBTQ individuals, when homeless, are more likely to engage in riskier behaviors and more dangerous survival strategies than non-LGBTQ homeless individuals. So this could be survival sex, it could be any risky behavior that they might be engaging in to help them while they are experiencing homelessness. And related to that, we see high rates of HIV within the LGBTQ homeless population. And we also see that within the homeless community, LGBTQ individuals face a lack of inclusivity and discrimination from homeless shelters and other services that are supposed to be supporting homeless individuals. So you can think of shelters that are designated for women and children, or just women or just men, for homeless individuals. But we have non-binary individuals, we have transgender individuals who may not fit the mold that these shelters might be putting out for their members, as well as the presence of unisex or non-binary or transgender bathrooms at these shelters, which can put LGBTQ people at risk for danger, for discrimination, and for injury, honestly, within these shelters that they're supposed to be feeling safe within. So that's another population that you should be aware of, their rates as well as their experience within the homeless community. And a main point of this module is not only to define what homelessness is, but as medical providers, understand how homelessness impacts an individual's health. And it truly is a bidirectional relationship, because you have mental illness and chronic illness as major risk factors for homelessness, so that those can predispose you for homelessness. But then homelessness has a major impact on someone's health, as I'll get into, worsening their health and going the other way as well. So homelessness and health issues are bidirectional. Sometimes they can be cyclical, but essentially homelessness creates several different conditions, whether it's limited access to health services, both lacking health insurance or ambulatory care. We see high rates of low health literacy within the homeless population. We also see homeless individuals having higher vulnerability to the environment. So if they are unsheltered and they're exposed to the heat or the cold or the rain or the snow, the physical threats of the environment to these individuals. We see that homeless people, or those suffering homelessness, have competing priorities. So when you're homeless, you might be trying to find housing. You might be trying to find access to food. You might be trying to get enough money to do those things. So you might not necessarily be prioritizing your health at this time, which can certainly have an impact on their health. We have homeless individuals having difficulty complying to outpatient and discharge plans because they don't have the means to complete those discharge plans, or because they have competing priorities preventing that compliance. Similarly, because they have difficulty managing chronic disease because they can't comply to those discharge plans with in their current conditions. And we also see high rates of distrust of medical establishments within homeless populations. So these conditions, you might call them, or effects of homelessness on an individual, all accumulate in their unique experience for a homeless individual and can lead to several different health issues. We see higher rates of chronic illness, higher morbidity and higher mortality in homeless populations. We see higher rates of acute illnesses within homeless populations. So we have higher communicable disease rates like tuberculosis, if you think of people who are living in close quarters with others from different, who are traveling from different areas to then be in the shelter. We also see high rates of HIV infections and high rates of hepatitis infections, and that's partially due to the high rates of injection substance use within this population. Another health issue that is highly associated with homelessness is medical conditions presenting later, or the patient presenting for medical attention later in the course of their illness. So their illness is more severe by the time they get themselves to medical attention. We see higher rates of inpatient inpatient treatment because of this more severe state of their disease when they do get to medical attention. And then out of specific medical conditions across the board, we see high rates of foot problems with homeless individuals because they're on their feet all the time. They don't necessarily have a stable place to rest and fully clean their bodies, clean their feet, and they might not have clean shoes or clean clothes to fully protect their feet from the environment. We see poor dentition, again, because they may not have a reliable place to brush their teeth, to floss their teeth. They might not have access to floss or toothbrush or toothpaste because of their financial or housing conditions. We see high mental health problem rates in homeless populations. Things like depression, anxiety, suicide, we see those with high rates within the homeless population. And then, like I've said, we see high rates of substance use within homeless populations as well. So those are some major health issues that we see across the board with homeless populations. We also see specific health impacts on women and children. So homelessness is very prevalent during pregnancy for women. So pregnant women are at risk for homelessness, and then because they're at risk for homelessness during pregnancy, we also see high pregnancy complications in homeless women. We see that homeless women have decreased access to contraception, and they're also having increased chances of having multiple sex partners in unintended pregnancies. We see that disparity with homeless women versus non-homeless women. And we also see that women who are homeless have higher rates of physical and sexual assault and are at risk for that. So as a provider, be aware of this. If you have a woman who is homeless, ask them questions about their sex history, about their relationships with others, about potential assaults, because they are prevalent for that population. With children that are homeless, like I said, 1/4 of all homeless of all the homeless population in the United States are children. And we see increased rates for infectious diseases like respiratory tract infection, like diarrhea. We see that children have nutritional disorders if they're when they're homeless because they're not getting, in addition to being homeless, homelessness can lead to food insecurity because they don't have a kitchen or pantry to store and cook food reliably, and they're relying on food from shelters or getting food where they can. We see higher rates of asthma in homeless children in homelessness. And we also see developmental delays with children in homelessness. And something that I want to mention is that these health impacts on homeless populations, these vulnerabilities that homeless populations have that impact their health, are going to just increase with the current climate change trends that we have going. So if we have homeless populations, especially the homeless populations that are unsheltered, that are experiencing unsheltered homelessness, they are exposed to the heat, cold, humidity. They're more vulnerable to the natural disasters that may be happening with climate change. With climate change, we know that we're going to be seeing increased food and water insecurity, more vector-borne disease. So we're going to see increased infectious disease rates in homeless populations. We're going to see more malnutrition, more food insecurity, more health effects of that with this climate change that will disproportionately affect homeless populations more than they will populations that have stable housing. Therefore, it will exacerbate the increased morbidity and mortality that this population already sees, increase their emergency service use, and also with all these with climate change happening and sea levels rising, you probably will see an increase of homelessness prevalence within the population. So as you are a provider and as climate change inevitably continues, you should be aware of not only the stresses of the homeless population, but how they're increasing with climate change as time goes on. So this was our presentation on homelessness and health. I hope you've taken away what homelessness is, how it varies for each individual experience, and the impact that it can have on an individual's health. We'll continue with another presentation on how to identify and address this homelessness as in your patients as a medical provider. Thank you.